Let's talk about common signs and symptoms. What should the audience be looking for? Dr. Coleman, can we start with you?
Yeah, well, as I previously mentioned, symptoms tend to come on slowly over time. When symptoms begin, they tend to affect just one side of the body, and that side of the body can be random. There are three main symptoms that affect the motor skills in Parkinson's, meaning movement, and we call these the cardinal motor features. So let's talk about what those symptoms are. So the first would be Brady Kinesia. And in medicine, we like to give everything fancy names. Brady Kinesia is our fancy name for slowness. And this can be experienced in many different ways by patients. It can be a slowed, shuffled walk. It can be decreased arm and leg movements, decreased facial expression, or maybe even the less well-recognized, smaller handwriting, problems projecting the voice, and difficulties with dexterity, such as fastening buttons or tying shoelaces. I think the important thing to remember is that no two individuals with Parkinson's experience symptoms in the exact same way. So just because we bring up a symptom tonight, it doesn't necessarily mean that it will be a problem symptom for you or your loved one. In fact, tremor is probably the most well-recognized symptom in Parkinson's. And 1 out of 3 individuals do not have tremor at diagnosis.
Certainly there are motor symptoms, as Dr. Coleman said, and there is a big chunk of non-motor symptoms that's not immediately visible because they have nothing to do with movements. Talk about a few. Well, let's put it in perspective. The disease process of Parkinson's starts 15 to 20 years before you ever have your first symptom of Parkinson's. For example, say a tremor. The process starts way before. We really think the Parkinson's actually start in the gut. That might explain why someone has a constipation for a very long time. Long before, I'm thinking about 6, 7 years before they actually have the first motor symptom, say, for example, a tremor. When we also notice that the spouses have been complaining, and the patients, they're in the bed, they're having these vivid dreams, and they're actually acting out their dreams. They're actually moving a lot, shouting, screaming. Spouses are getting hit. We see spouses coming with black eye. We treat the symptom for the benefit of the spouses. And of course, the third symptom we saw is loss of smell. Some of them lose their sniffer very early on. I'm talking about 5 years to 10 years, even before they have the first symptom. These are all some of the non-motor symptoms that we see. And again, as the disease progresses, we notice that they have anxiety. It is one of the common symptoms, anxiety, and it could be very disabling symptom. Anxiety that is out of proportion to the situation. You don't have to have another reason to be anxious. You're anxious because you have Parkinson's disease. We also notice that they have depression, mood. The mood is all we have. If the mood is not great, nothing will be great. Depression is a symptom of Parkinson's as well. Trouble with memory is another symptom as the time goes by. Slowed thinking process, blood pressure fluctuations, urinary symptoms, frequency. These are all some of the non-motor symptoms of Parkinson's. When we talk about treatments, we got to treat the motor component and the non-motor components. And treating the non-motor component is as important, if it's not more, treating up motor symptoms of Parkinson's disease.
So let's say I've got symptoms, I've got signs, and I've talked to my primary care physician. What do I do next to be evaluated and diagnosed? Dr. Coleman, why don't we start with you? What do you consider the basics?
Well, you're right in that most individuals will go to their primary care physician or their family medicine doctor to first address their concerns. During that visit, they may get or maybe even request a referral to see a movement disorders neurologist, which is a Parkinson's specialist like ourselves. Once you come to see us, we spend about an hour talking with you about your symptoms, doing a neurologic examination. Now, the important thing to know is that the diagnosis of Parkinson's is clinical. And what that means is that there's no one piece of blood work, There's no one piece of imaging studies like MRI of the brain that give us a definitive, black and white, 100% answer as to whether or not someone has Parkinson's. The diagnosis is based on what you tell us, as well as what we see on examination. And sometimes, in more difficult cases, we may want to see how those symptoms or that examination changes over time, meaning over the course of multiple visits, or how you respond to a medication that's typically intended for Parkinson's. So it is this subjectivity to the diagnosis, meaning that it's based on what you tell us and what we see, not based on a single definitive test like a biopsy. That is one of the many reasons that it's important to see a neurologist who specializes in Parkinson's.
Absolutely. One of the most important things is diagnosis. Accurate and a correct diagnosis is the important step in the whole process. Think about it. There are so many of those diseases, we call it as Parkinson's mimickers. They look like Parkinson's, at least initially, and we notice that they're actually progressing faster. We also noted that they're not responding to the traditional medications we use to treat Parkinson's. Something different about them, even though they start off just looking like it. For example, multiple systems atrophy is one of those, we call it as a Parkinson mimicker. And there's another condition called Lewy body dementia. And again, starts exactly how the Parkinson starts. Again, there's a confusion about this, people having tremors. In fact, the most common movement disorders is actually something called as essential tremors, or the familial tremors. Most often, Parkinson's is actually mistaken for an essential tremor. And the opposite is true as well. Often, an essential tremor is actually diagnosed as Parkinson's disease. That's why I'm stressing it's very important to see someone who specializes in Parkinson's disease early on in the disease to actually get an accurate diagnosis. That's why, because the treatment is only effective if you have an accurate diagnosis.